I am delighted to be here. I have good things to say and some things, well, maybe not so good. In the last 2.5 years, I have been in the hospital twice. I was in the surgical unit in ICU and recently in the cardiac care unit. And in all those 3 instances, I received excellent care. I have absolutely no complaints about that at all. I had a nice little incident happen in ICU. I was in there because I had an adverse reaction to medication. So obviously I was confused and didn't know what I was doing. And obviously the nurses came in every day and must have said, "Do you know where you are?" So one day they came in, they said, "Do you know where you are?" And I said, "Yes, I'm at the Sudbury Regional Hospital. You were over $200,000 over budget, and you were 450 parking places too short." And so she said, "I think you're ready to go to the floor," which I think was sort of. I really enjoyed that because that sort of tells you really the treatment that I got, and I was very happy with it and have no complaints. And I did write a letter, both in French and English, to the hospital to thank them for my excellent care. I had 2 other incidents of being in the hospital. One was last November when I got new bifocals. And anybody that's got new bifocals know what happens sometimes. You trip and fall. So I fell and broke my arm. So I went to Emerge, that's where I again got excellent service. And that happened on Thursday afternoon, and I came home early Thursday evening. And this is where the problem started, because I was 2 days with sitting in my hospital gown. I did not get, I was to get care from Community Care Access, and they didn't come 2 days later. Now, I live alone. I have friends, though, and people could come and help me, but that really wasn't the point. And then to get other care, I don't know how many phone calls I made to different agencies. And one agency, when you call them up under one homemaking, there's 4 different numbers. And first one I called, it was the Sioux. Now, the reason I'm complaining or mentioning these things is I speak English and I am aware of the services in Sudbury. And I knew the services I should be receiving. But if I were 85 years old and Ukrainian, and English was not my first language, I wouldn't have bothered. And that is the problem. We need to have, I don't know how many phone calls I made. I hate to think, at that time my vision was fine, so it wasn't a difficult thing for me to do. I could look the phone numbers up. But the number of phone calls I made to get services that I needed. Now, mind you, I have the services now, and when I got the services, they were excellent, so I have no complaints about the services, either in the hospital or at home. They're very good. But the process was getting them. And I didn't get discouraged because I knew that this is what should be happening. And it got to be kind of a joke. And I kept a diary. I don't have it with me because I can't read it, but of the phone calls I made. And I think it ended up to be about 3 or 4 pages. And if we're going to be at home, seniors want to be home. They don't want to be in the hospital. They want to be in their own beds. They want to watch their own television. They want to have tea when they want it. So they don't want to be in hospital. But if they're going to be going out of hospital, you have to have the services for them. You can't wait 2 or 3 days. It's just not possible. And that's what happened to me. Now, it didn't matter. I just had a broken arm. I mean, I had nothing dramatic, just a broken arm. So I could manage, but some people cannot manage. And because I don't have notes because I can't read them, but I just wanted to make one comment about being in the hospital. Get people out of bed. I got out of bed, and I was running around the hospital with my, whatever you call it. They're attached to all sorts of things. And there was another woman in the room with me who didn't get up. And when you're a senior, you can't be, and she could have gotten up, it's just that people didn't have time to get her up. And if we are allowed to lounge around in our beds, we're going to get weak and we're not going to be able to manage at home. I think when I was coming in here today, I think if you walk in the hospital for if you walk in, you should be able to walk out. And I think that that's one of the problems, that there isn't enough activity. Or this lady in the next bed to me, she could have gotten out of bed. Well, actually, New Year's Eve, I said to her, let's get out of bed. So I got her up, and she could have gotten up. That wasn't the issue. So I think that I would like to emphasize that, to get people home and keep them healthy. And I just wanted to talk about another incident that happened last week. And I think people need to hear these stories, because if you don't hear them, it's not going to get better. This friend of mine's mother, she fell. She was dizzy, and she fell last Friday, and she broke her ankle. She went to the hospital, and she got a cast on, and she came home on Friday. On Saturday, one of her children was there because it was the weekend. Had to go out to get some groceries, and when she got back, her mother had fallen again, was dizzy, and fell again. And she went back to the hospital. Not then, I think they didn't go back to Monday. They went back to have the cast reviewed, and then she went back yesterday to have a new cast put on. But the home services started on Tuesday. She had physio, so that meant that this person was Saturday, Sunday, Monday without services. And you can't expect a 79-year-old person that has a cast on, non-weight bearing, can't use crutches, to be at home with nobody to help her. Now, mind you, it was a weekend, and our family were off, so they were able to help her. And because I worked in healthcare for a long time, I was kind of aware of what should be happening, and I'm only telling that last story there because that just happened. Normally, I just tell my own. But the thing is that we have to know that. We have to know that the problem in the hospital, I got excellent care in the hospital, no complaints about that at all, and excellent care in the home. The problem is that part in between. They've got to come together. So maybe there could be somebody, I came out of hospital and got referred to Emerge. Maybe somebody should be there at Emerge. You're being discharged. What are you going to do, Dorothy? And someone to be there to get people out and to get them the services to start at least within 12 hours, especially if they live by themselves. Now, I can only talk about broken bones because I had a broken arm and my friend had a broken ankle. So that is just simple things, but you need certain services. I sat around for 2 days in a nightgown because my arm was attached to my body and I couldn't get out of my hospital gown. So that is my main thing. Please and don't, when I have at home, I have 4 gorgeous brochures from 4 agencies with this lovely picture of a nice white-haired lady, older lady with a nice friendly nurse standing beside her, full of literature. I'm not going to read the literature. If English or French is not your first language, people are not going to read that stuff. Don't spend money on that. And since I had just a simple broken arm, each agency could have called up and said, "Oh, Dorothy's doing fine. I was just there yesterday and she's doing fine." I had supervisors from all those agencies come and visit me. Actually, they came in all 2 days. That is not necessary. I think there should be better communication. One person to say, I was there, or email. Don't even need a phone, you can just email. and some common connection to know who's there and to have some communication among them, that this information could be shared. As again, I said, I just had a broken arm. And that if you're complex care, that's a different thing. But for me, I didn't need all those services. Mind you, I enjoyed them and I had good chats with them, but I didn't need them. And really, I know that many people have heard this. I tried to make my story different because I think this is about the 4th time I've told it. And I don't have notes, so if I repeat it myself, I'm terribly sorry. But that's really all I have to say.